my name is Jordan and I'm a student nurse, and I'm going to teach you how to administer insulin and where to administer it at, and when you don't want to administer insulin. Have you ever had insulin before? Okay, great. Well, we're going to go ahead and get started, and I'm going to teach you how to inject insulin. Do you have any questions before we begin? Okay, perfect. So you first want to start off by gathering all your materials, and so you have your syringe, you have your rapid acting insulin, which is a regular insulin, and this is clear, and this will take, the onset is 10 to 30 minutes, and it will last about 3 to 5 hours. And then you have your intermediate acting insulin, which is your MPH insulin, and that will last 18 to 24 hours. So you want to make sure that after you have used, if you have already opened the containers and administered and already used them and there's insulin left in there, after 28 days you want to make sure to throw it away because it's not good anymore. Okay, and then so first you want to start off, you make sure you check your expiration dates before you administer, before you start drawing back insulin. So you want to start by taking your cloudy insulin and you want to roll it in between your hands gently. You don't want to shake it because it'll cause air bubbles. So then you take your alcohol wipe and you wipe off the top. Okay, and then you want to go ahead and open your syringe. You want to open your syringe and take the cap off. Okay, and then so you're going to have 10 units of your clear insulin and 10 units of your cloudy insulin. So you want to start off by pulling back on the plunger 10 to 10 units. And then you are going to stick it into your cloudy insulin and administer the air in there. And then pull it out. Okay? And then you're going to pull back again another 10 units of air. And then before you insert it into the clear insulin, you want to wipe off the top of that with alcohol. And so then you're going to do the same thing and insert that into there and insert the air into there. Okay, and then you do not pull the syringe out or the needle out of it, and you want to flip it upside down and pull back 10 units. Okay, and while you're doing this, you want to check for air bubbles, and if there's air bubbles, you want to firmly press it to the top, firmly flick it, and get the air bubbles up to the top, and then you're going to push up the air bubbles to get the air bubbles out back into the vial. And so then you want to pull back down to 10 units again to make sure you have 10 units, and then you're going to check for air bubbles again. So then you take that out, and put that aside. And then, so now you want to do it with your cloudy insulin. And you're going to insert it into the cloudy insulin, flip it upside down, and so you want 10 units of your cloudy insulin, and so you're going to pull back to the 20 units. And again, you want to check for air bubbles. Okay, and so then when you're capping it, you just want to do the scoop method. So you don't want to ever pick it up and put the cap on because it's very dangerous and you could stick yourself. Okay, so your injection sites, so it's subcutaneous and it's going into the fatty tissues. So good spots would be your abdomen is a very common spot, and you want to make sure it's 2 inches away from your belly button. Also the back of your arm is a good spot where there's a lot of fat, and your buttocks, as well as your thighs and your lower back. Okay, and then you want to make sure that you rotate sides. It's very important. Also, before you administer your insulin, you want to check for skin breakdown and scar tissues. You want to avoid those areas. Okay, so then you're going to start off by wiping off. So I'm going to pretend that I'm going to do this in the abdomen. So I'm going to pretend, and it's going to be 2 inches away. And I'm going to wipe off the area with the alcohol gauze. And then, so it is also important that you, okay, so if you want to pinch the skin before with one hand, and if you can pinch an inch, then you go at 90 degrees. And if you cannot pinch an inch, then you go at 45 degrees. So for this sake, we're going to say that I pinched an inch and am going to administer the insulin at 90 degrees. And so you want to do this pretty fast, so it hurts less. And so you administer it at 90 degrees, push down and inject the insulin, hold it for 5 seconds, and pull it out quickly. And so after, you do not want to massage the area, and you do not recap it. You push the safety in by pushing the plunger all the way in, and that'll pull back on the safety, and then you want to discard it in your sharps container. Okay, so do you have any questions?
No.
Okay, so I'm going to have you teach this back to me. So you have your cloudy insulin, and you have your clear insulin, and here's a syringe and an orange.
Okay. So first thing, I'm going to make sure I have my 2 vials, and I'm going to check the expiration date. And then from there, I am going to wipe off the top of both of my insulins. Okay. And from there, I'm going to grab my needle. And I'm going to take off the cap. And I'm going to pull back to 10. From there, I inject into the clear first. Correction, cloudy. I'm glad I'm learning.
And before you do that, you want to roll it gently in your hands. And you never want to recap it by picking up the cap, so you just want to do the scoop method.
Okay.
So pick up your cloudy insulin and gently roll it in your hands. Do not shake it.
Is that good?
Yes, that's good. And then you can go ahead and inject the air into your cloudy insulin.
Alright, make sure I have 10 still. And I'm going to inject 10. And now we'll pull back up. And pull up 10 more. I will inject 2. Checking for bubbles, flipping to the top if you need it, and pushing bubbles back again. There's 10. Now I'm going to pull it out and go to my cloudy. And pull back another 10. Here, I'm going to go ahead and going to use the fatty sites, such as my abdomen, my buttocks, or the back of my arms. And if I can pinch an inch, I'm going to go at 90 degrees. Otherwise, I will go at 45 degrees. After cleaning my psych, I'll get my insulin, and for the sake, I will have pinched an inch, inject at 90 degrees, push down, hold for 5, and then pull out, and make sure that I push back.
Yep. And then just make sure you put it in your Sharps container when you're finished. And that is how you inject insulin.